Today we will discuss about the clinical based question of varicose vein. A bus conductor is coming to OPD, have a complaint of dilated and tortuous vein in the leg and pain due to the claudications of the muscles. What is the probable diagnosis? Explain the great saphenous vein in detail. Explain the peripheral heart. Answer is the probable diagnosis, it is a varicose vein. The great saphenous vein course, it is the largest and longest superficial vein of the lower limb. Saphes mean easily seen. It is the continuation of the medial end of the dorsal venous arch. On the dorsum of the foot, it runs anteriorly to the medial malleolus. It lies anterior to the medial malleolus and crosses the lower one-third of the medial surface of the tibia. Run 1 centimeter posterior to the medial border of the tibia, lies hand width nearly 3 to 4 inches posterior to the patella at the knee joints. Runs up and passes through the facial aorta or deep fascia of the thigh through the saphenous opening, join the femoral vein 4 centimeter infralateral to the pubic tubercles. So it is open inside the saphenous femoral vein through the saphenous opening, which is the gap inside the facial aorta, and it is situated 3 to 4 centimeter infralateral to the pubic tubercles. It contains 10 to 15 valves which prevents backflow of the venous blood. One valve always present at the saphenofemoral junctions. Incompetency of the valve makes the vein dilated and tortuous, leading to the varicose vein. The tributaries of the great saphenous vein, it is inside the leg posterior arch vein, and this posterior arch vein, it is a superficial vein, communicate with the posterior radial vein, or it is the deep vein by the 3 perforators. The perforator, it is the lower medial perforator just below to the medial malleolus, medial perforator just above to the medial malleolus, and the upper medial perforator lies at the junction of the middle and lower one-third of the leg. Another tributaries of the great saphenous vein inside the calf, anterior leg vein, and few veins from the calf communicated with the short saphenous veins. Tributaries inside the thigh, anterolateral veins, posteromedial veins, supiepigastric veins, superficial circumflex iliac vein, superficial external pudendal vein, and deep external pudendal veins, which are the tributaries of the great saphenous vein, and it is open inside the great saphenous vein, and then before it open inside the great saphenous vein, this vein pierces to the cribriform fascia, and so that's why there are many holes. It lead to its. That's why it is called the cribriform fascia. So these are the tributaries: extrapudental vein, superficial epigastric vein, superficial medial femoral vein, superficial circumflex iliac vein, superficial lateral femoral veins, and so these are the tributaries of the great saphenous vein. Factor helping into the venous return against the gravity. General factor which is help into the venous return are the negative intrathoracic pressure. So always the pressure which is goes negative to the positive to the negatives. Arterial pressures and overflow, compressions of the veins, and presence of the valves. Local factors inside for the venous return inside the leg, it is the venous muscular contraction, and there is a facial deep fascia. Clinical importance of the great saphenous, it is used as a graft for the bypass surgery when there is a block the coronary artery. Trendelenburg test, this is done to find out the site of leak or defect in the patient with the varicose vein, mainly the incompetency of the valves. Only the superficial vein and perforating vein can be tested, not the deep vein tested by the Trendelenburg test. First of all, patient in supine position raise the leg to empty the superficial veins, and now the pressure applied to saphenofemoral junction and patient asked to stand up quickly. If the pressure is not released at the saphenofemoral junction for 1 month, if the pressure is not released for 1 minute, though the superficial vein is filled up, it indicates that perforator are incompetent. Normally the superficial vein drain into the deep vein, but here it is the reverse. If the pressure is released immediately after the standing, the superficial vein immediately fill up from above to downwards. It means there is incompetence of the saphenofemoral valve. The calf, what is the calf pump or peripheral heart? The soleus muscle, it is called the peripheral heart. When the muscle contracts, blood contains the large sinuses within its pump into the deep veins. When the muscle relaxes, the blood flow into the sinuses from superficial vein, and unidirectional blood flow is maintained by the valve in perforating veins. So soleus, it is called the peripheral heart. So hope you enjoy the clinical based question of the varicose vein. Thank you.